Hello and welcome to today's webinar from Esendex, Managing Patient Appointments in a Healthier Way. And what we'll be doing during the course of today's webinar is discussing how healthcare providers can use mobile-focused communications, like the ones that we'll be talking about later on, to make and manage their appointments in the wake of the coronavirus pandemic. So just before we get started, just a couple of introductions to make. First of all, myself, my name is Warren Delay and I'm the Product Marketing Manager here at Esendex. And later on, to introduce us to the products and solutions that we'll mainly be talking about, we'll be hearing from Adam Rathbone, who is the Senior Solutions Consultant here at Esendex also. So what is it exactly that we're going to be covering today? Well, first of all, we're going to take a look at the perennial appointment challenges that healthcare providers face. So these are the challenges that would have been encountered even before the start of the coronavirus crisis. We'll then move on to take a look at the specific challenges that have been brought about by coronavirus. And we'll also take a look at the way that healthcare providers are currently managing their patient relationships and how they may need to change given the context of our current situation. We'll then take a look at what's driving healthcare providers to transition from their current systems to a more mobile-focused communication strategy for appointment management. And we'll also be explaining the new relationship between patient and healthcare provider and what that looks like given the limitations that have been placed on us thanks to coronavirus. Adam will then be taking the reins, where he'll be talking us through all of the different products and solutions that are available that can help healthcare providers manage their patient appointments by targeting their mobile devices. So let's begin by taking a look at the perennial challenges that healthcare providers face with appointment management. Now, the best and probably most well-known problem that they face is the cost of missed appointments. If we just take a look at the statistics on the right-hand side of the screen there, you can just see that the cost of missed procedures and also GP appointments, even before the coronavirus pandemic, was close to £1 billion a year, which was obviously a massive loss for the NHS. Now, if we actually take the average salary of a nurse, which is £25,000, and use that pool of missed appointment cash that we have, that would be enough to pay for 36,480 nurses per year, which really puts that figure into context. So a better communication strategy can help at least reduce this figure somewhat and recoup some of that lost resource. It sounds really obvious to say as well, but if somebody doesn't turn up for a healthcare appointment, then it's not just them missing the appointment, they're also depriving somebody else of having that appointment as well. And at a time when especially GP appointments are going to be at a premium, we can't really afford to be wasting GPs' time. So we really need to make sure that all of their time is accounted for and the patient can do their part in helping out with that by turning up to their appointments promptly. It also might sound like an obvious thing to say as well, but a lot of money can be saved by switching to a digital communication strategy as well. So at present, a lot of letters are being sent out by healthcare providers, manual calling, and these are just some of the communication channels that can be replaced or complemented with modern digital solutions to reduce that cost and then reallocate that resource to other parts of the health service. And what are the specific challenges brought about by the coronavirus crisis? Well, you might remember at the start of the crisis that all non-essential healthcare appointments, especially with general practitioners, were cancelled. When all of this is over, hopefully that's sometime very soon, how are those backlog of appointments going to be managed, and how can the healthcare providers work through them in the most effective way? Heaven forbid, but if demand for healthcare appointments were to spike, then how would the healthcare providers manage that? You know, if they only have limited amount of resource and administration team to manage incoming calls to the practice, how can they manage that influx of calls and at the same time provide great service to their patients? It may also be the case that in some instances the actual consultation between healthcare professional and the patient may take place over a telephone. Now, whether that be through a phone call or a text-based chat, how can that new relationship between healthcare professional and patient be explained in a way that's easy to process and understand. Social distancing may also have a part to play in this. Of course, the government has placed restrictions on the way that we interact with one another, but this also may have ramifications for the amount of people in practices, how we go into the practice, what we do when we get there. How can this information be relayed to the patient and supply the best practices to them? As we've already touched on, the healthcare providers will still want to maintain excellent service to their patients, and that means providing reliable and timely service. How can we manage that, and how can we ensure that that still happens given the increased volume for requirements and also calls into the practice? There is also the patients to consider that have medical issues but aren't directly affected by the coronavirus pandemic. So these are the people with maybe heart conditions or things like that still need to have medical attention. How do we make sure that we let those patients know that the services that they require are still available and that they still have access when it's required? So what's wrong with the way that healthcare providers currently manage their patient appointments? Well, the first thing to consider is that a one-size-fits-all communication strategy no longer really does the job. While letters have played their part for quite a long time now, it's worth considering that different demographics engage with different channels in different ways. So, for instance, a more mature audience might still find value in a physical letter, but your younger demographics won't respond as well to a letter, and in turn that can affect the amount of missed appointments that you have. So it's worth considering the different demographics that you're approaching, and also accommodating for that with the choice of channel that you make, or channels that you may need to make in order to reduce the amount of missed appointments that you have. There also aren't enough self-serve options for patients. So what we mean by this is removing the requirements to have an interaction with a member of staff to manage their appointment. At present, it's often the case that you'll need to call into a healthcare provider and make a change over the telephone. Now, obviously, this presents problems on both sides of the fence. It's often tricky to get in to actually connect to a member of staff. Often it takes 2 or 3 attempts to make a call and actually be able to speak to someone to make that change. And on the other side of the fence, it's resource heavy to manage all of these calls. So I'm sure we've all been there. We have to ring up first thing in the morning to try and get an appointment or make a change to an appointment, but you just can't get through at the other end because that there may be only 2 or 3 administrative staff to manage those calls, and it's just not feasible for them all to be managed at once. So as we touched on earlier, letters aren't the answer. If we look at some statistics to back that up, direct mail has a 75% open rate versus a digital channel like SMS, which has 95%. Obviously, this is going to have a knock-on effect to people not turning up to appointments because they potentially won't have opened the reminder telling them when the appointment is in the first place. For non-appointment reminder communications where it actually needs a response from the patient, letters are also pretty ineffective. In fact, the average response time when collecting data through a direct mail approach is 17 days. That's the time it takes from the letter to be sent from the healthcare provider, reach its patient, and then the patient to send something back is 17 days. On average, this takes 90 seconds for SMS, which is obviously a massive improvement. There's also a cost aspect to consider when sending letters. So if we're sending around 1,000 appointment reminders, let's say, that would cost around £500 to send through direct mail. The cost through SMS would be £38. Again, this is cost saved and can be spent elsewhere on providing service to patients. So on to phone calls. As we've mentioned earlier, only one interaction with a patient can be managed at a time per administrative staff member. When the healthcare provider needs to contact the patient and they have to leave a voicemail, 90% of voicemails are actually ignored. So if this was an important information relay or an appointment reminder that was passed on through voicemail, chances are if you leave a voicemail, it's going to get ignored. And as we've already mentioned earlier, phone lines can easily become blocked and inaccessible to patients at peak times. And there's a convenience aspect for the patient to consider as well when managing appointments through phone calls, in that they can only actually ring up and manage that booking during the practice's working hours. So generally that's 8 till 6 o'clock. Any time after that, they just have to wait until the next working day to ring up and hopefully get through to make the change to their appointment. So I think it's safe to say that when we look at all of those factors, that letters and phone calls are inconvenient for both the healthcare provider and also the patients themselves. So what is it that's driving healthcare providers to transition to mobile-focused communications? Well, we've just got a few statistics on screen now just to sort of showcase why we think that's happening. And the first one is that 75% of patients now say they'd prefer to text a practice rather than have a telephone conversation with them. Now, I think this just exemplifies the point that patients are now looking for that convenience of being able to interact with healthcare practices at a time and place that suits them, rather than being constrained to the practice opening hours, your usual 8 o'clock till 6 o'clock. They want to be able to interact at a time and place that suits them, and that's why they prefer to have a text-based interaction. We can also see that the average Brit spends 3 hours and 15 minutes every day looking at their mobile devices, and they actually check them 58 times per day. This shows us that for healthcare practices who want to have more successful interactions with patients, then a mobile communication strategy is definitely the way to go, rather than persevering with something like direct mail communications. Patients are already starting to gear up for healthcare related interactions via their mobile device as well, so whether that be to research a particular ailment or some sort of condition that they might suspect they have, they're already doing that on their mobile devices. And we can just see that 52% of smartphone users are already gathering health related information on their mobile devices. So they're looking to have those healthcare related enquiries on their mobile devices already. As well as providing convenience to the patient, it can also provide convenience to the healthcare provider themselves as well, with the facilitation of some processes like appointment management being able to be dealt with via the use of APIs and bots. This will just free up so much more time for your in-house administration staff to focus on more complex tasks. And as well as for appointment management, mobile communications are being used for a host of other use cases in healthcare, including carrying out virtual appointments, supplying richer health advice in the form of images and video. Adam will talk us through all of these different use cases later on in the presentation. So just before we hand over to Adam and take a look at a few of those products and solutions that will help us remedy the issues that we're looking at today, it's worth explaining to patients what their new relationship with providers will look like and answering a few of the burning questions that they will have and what the new dynamic between healthcare provider and patient actually looks like. So in the context of the coronavirus pandemic, obviously patients are still going to have a lot of questions about what the symptoms of coronavirus are and what do they do if they have any. They will also require the best practices for taking that one step further and how they can go about making their appointment to see a GP or getting some sort of consultation, whether that be remote or face-to-face, in the best way to follow on from that. As the situation continues to evolve with coronavirus as well, the government guidelines and healthcare guidelines will change periodically as well. And it's worth keeping our patients up to date with what the best practices for social distancing are and keeping safe in public, and especially in the surgery as well, just to keep that fresh in patients' mind, just so that we don't risk people becoming complacent and risk infection. We should also reiterate the best practice for non-coronavirus related conditions as well. So what should patients do if they have a condition which isn't coronavirus related? Should they approach the surgery? Should they ring up? How is that dealt with by the healthcare provider? That type of advice will need to be relayed to the patient. Just as a general query for patients as well, it'd be nice for them to know how the prioritisation of appointment allocation works as well. So whether certain demographics, whether they be the more mature people, will they be prioritised for appointments? Or, is it a first come, first serve? These are the types of frequently asked questions that we can automate via a mobile communication strategy. And also, it's going to be great for patients to know what the sort of long-term plan is for healthcare providers. So once the situation starts to return to normal, how will the appointment management system change? And is there anything that they need to be aware of to accommodate for that at their end? We can just see on the right hand side of the screen here one of the solutions that Adam will talk us through. So this is an SMS landing page, and this just provides a very quick reference for question and answer sessions, whereby patients can click on a particular question that they might have, and it will just link off to a resource where that particular question could be answered. But again, Adam will go into more depth with this particular solution now. So what I'll do now is I will just hand over to Adam, and he'll talk us through some of the solutions and products that we've spoken about so far.
Thank you very much, Warren, and hello everybody. Hope everyone is well and keeping as safe and well as can be. Thank you all for taking the time to join us. My name's Adam, and I'm just going to go over a few of the different solutions that can help benefit those challenges and problems that Warren has just gone into detail about. So the first one that we'll talk about is one that you're probably all very familiar with, and that's SMS messaging. Now, most of you will have at some point received a text message from either your doctor, your dentist, for an appointment reminder. And that has been a tried and tested form of communication for a number of years now within the healthcare profession. And, there's many reasons for that, but, some of the key ones to call out is the fact that it does give you that high open rate. SMS is proven to give you a much better open rate against any other channel, whether that's email or direct mail, with an average of around 95% of all messages getting open. And our stats back up that they're open within 3 minutes of being sent. We live in a world where, unfortunately, our phones are never too far away from us, and therefore, whenever messages seem to go through, even if you're at your work, even if you're at work and on your desk, then those little notifications pop up. So you will be reading them, and unlike direct mail and email, those messages will generally get read. And they can, of course, be personalized for every single patient. But also, SMS gives you a number of other opportunities, and we've seen a switch in the last few years where people are now starting to take advantage of two-way SMS and not just keep messaging as a one-way notification system. So by offering two-way messaging, you give the ability for all of those patients to reply back. And we're living in a society where people don't like picking up the phone as much these days. A lot of people's personal preferences is that they will do their communications in some form of texting, whether that's on SMS or some of the other options that I'll come into a bit later on. And by opening up two-way, it gives you the ability to reply back. So, the main use case for sending out appointment reminders is that you want people to attend. And if they can no longer attend, you want them to let you know, because there's obviously a huge cost and implications for people who miss those appointments. So by making it easier for that person to let you know that they no longer need that appointment with the knee specialist, or that toothache they had has gone away, they can do those simply by replying to that text message. And that can enter a two-way chat system that can be forwarded on as an email. So there's a number of options in which the admin people within your organization receive those messages and obviously action them where applicable. As well as doing SMS for appointment management, then obviously there's these other additional applications in which it can really add value for you. So, one of the things that I really love text messaging for is the ability to send proactive, late notice communications. I think the worst thing for anybody irrespective of whether you're a patient of a healthcare or, a customer of a business, is not knowing or having something, turning up for something and not being told. So, if for some reason that appointment needs to be cancelled at late notice, I think now more than ever with surgeries, when this pandemic first, came about, surgeries having to cancel non-emergency appointments, and shut down surgeries, that proactive nature of a text message where things can be loaded pretty quickly. You can have all manner of different automation. So, if you've got API functionality, the staff in your surgery don't need to be trained. They can just simply press a button and it does a send to all. And it just gets that message out pretty quickly. It can also be used as communications with staff, for letting people know news pretty quickly. Us as a business, one of the great things that I love about us using our own tools is, we, as part of our business continuity plan, we send text messages out to all employees to let us know of things like the office is not closed, when we're likely to be back in the office, or any other emergency notifications. So whether that's, trying to arrange additional cover, or if there's any security alerts. And these are just a few of the different things that you can really get value out of SMS for. And then, at the end of that, SMS could be used as a really powerful tool for getting feedback from surveys. So, how was your healthcare treatment today? How was the operation? All of those different bits, you can use SMS in that proactive way of sending out messages and people replying to them at a time and location that suits them, all on their favorite device. So another popular communication tool that we've seen in the healthcare industry is using outbound voice messaging. And again, it's a very similar use case for how SMS has been an effective tool. But with voice, the power that this channel has is that it makes it even easier for that recipient of the message to let you know whether they either still need to have that appointment, whether they need to cancel it, or if anything else important has come into the diary and it means that they need to continue with the appointment but reschedule it for another date. And they can do so by interacting. They can receive what would have been a text as an outbound voice, letting them know that, hi Adam, your appointment at the Queen's Medical Centre on Thursday with the knee specialist. Please press 1 if you need this, 2 if you need to cancel, or 3 if you need to reschedule. So you've already got them live and engaging on the phone, and it just provides them with a simple press of a button. You can either get the notification that confirms they're going to still have that appointment, whether they need to cancel, or if they reschedule, by pressing 3, we can automatically transfer them through to a member of your team to go through the booking process again and get that appointment confirmed in both parties' diaries. And it can be the same for inbound IVR technology because it largely uses the same tech. However, instead of you proactively sending that outbound message, if a patient needs to make changes to either their appointment or do any other gathering of information, then they can dial in a number and, using the options presented, self-serve in some way, shape or form. So the next thing that I want to talk you through is our mobile journeys solution. So essentially this provides your patients with an app-like experience, but the key thing is they're not having to download an app. They're just simply receiving a text message that contains a link, and once clicking on that link, it opens up a series of branded mobile optimized web pages. So it has the look and feel, as the slide demonstrates, for Alltree's medical practice of your organization. So the patient knows exactly who they're dealing with and can have that confidence that anything that they do and submit is going to the right people. So, similarly with that, original use case of sending out appointment reminders, like with voice and like with the two-way chat functionality, this just gives your patients another option to interact and confirm whether they still need that appointment or whether they need to reschedule. And the difference between this and other ones is it's just giving them the chance to interact on something that they're pretty used to. Nowadays, most interactions people do are doing on their smartphone. They're clicking through and they're going onto people's websites, apps, all of those different options, and having the ability to self-serve. So, once they click on there, as the slide shows, it can just give you the idea of rebooking an appointment. So showing in the native calendar or a calendar option there, selecting a date and time that is using real-time information from your booking system, and thus negating the need for having one of your staff actually there having to organize those appointments. It's using the technology available to be able to provide real-time information on what appointments are available. And then it confirms that back to the patient, providing the information of the new appointment for them to confirm and finish. But also, the mobile journey solution has a number of additional use cases. So because it is using that app-like technology, it provides you with the ability to request additional information. So, if they're trying to do some remote condition diagnosis, then you can ask the patient to provide any images or information relating to that query, and that can be done with a few clicks of a button by either taking an image there and then, or from that patient's camera roll. They can simply select the one, upload it, that gets passed over to you for doing that remote diagnosis, and then leading to the next conversation. It could also be used for receiving information about prescriptions, or any information relating to should that person have to pay for their prescriptions or not. So there's a whole array of different use cases that you can do using the mobile technology. On a fully branded, you can personalize it as much as you want, and importantly, it's giving the patients to access surveys at any time and any place. In recent times, we've seen the next evolution of SMS come in, and this is giving our customers the ability to provide more richer interactive communications out to their customers, and in this case, patients. RCS, which stands for Rich Communication Services, is one of those new channels that gives you the ability to do all of that and do so on an Android device. It gives you the ability to send images, videos, audio, rich cards, which you can see on the demonstration on this slide. And that rich card provides you with different buttons that make it even easier than all of those other solutions that we've been talking about. By simply clicking on a button, that patient can reschedule an appointment. They're not having to type anything, they're not having to say anything, they're just simply clicking a button. And as you can see, the bot technology that sits behind that can then present some new dates and times fresh from the booking system that can give that patient the ability to rearrange at a time that suits them. So once they've clicked another button, then we'll reconfirm in the rich card their new appointment date. And this is where this new technology really starts to show the value that it can add. It provides a number of options where you can either click for directions and using your native app, so most commonly a Google Maps, it can then show the directions to your practice, to the hospital, or wherever that healthcare appointment is. And even better, to try and mitigate that risk of missed appointments, it can pick up your phone's native calendar application, and any appointments, any important dates, by simply clicking one button, you can then add that to your calendar, giving you even more ability to try and remove the missed appointments, and giving that patient the option of having more reminders for themselves. So there's lots of great stuff that you can do for managing those appointments, but also it's not just restricted to that. You can send out all types of communications, and due to the fact that you can send images, that you can send audio, videos, all of those different bits, you're just scratching the surface with appointment stuff. And the fact that we have that bot technology that can automate all of those previous manual tasks, that can lower the cost to serve those patients and free up your staff time, it makes this channel, a real value add to any organisation. And where RCS offers real value, we have to be realistic and understanding that within the healthcare sector, the demographics are very broad. And, for every tech-savvy person who has the latest technology installed on the phone the moment those updates are released, there is people like my granddad who, will still be using a very minimal old school Nokia style phone, or, basic phones, and not have the latest Android or iPhone device. So if you still want to offer that same rich content as just previously demoed, then you have a fallback option, which is the SMS landing pages. Now, not the RCS stuff sends it directly to their inbox. For landing pages, you will have a link within that text, and when you click on it, you get a similar experience where you're getting that rich card out there, you're confirming the appointment, personalizing it, you're adding nice images, and you've got those call to action buttons. It's still offering a very comparable experience. However, it doesn't follow on and doesn't have the bot technology sitting behind it like the RCS, but you can still add to calendar, you can still change appointment, and you can still find those directions. So it's still providing, making it easier for that patient to do number of actions. You can do so in a self-service way, which is freeing up your staff time. You can mitigate the missed appointments by having them in the diaries. And also you can do things like you can link into chat interaction. So when you click on the change my appointment, one of the great features of our landing pages, and some of our customers use this separately, where they've not even thought about RCS yet, is by having that sitting in front of our two-way chat system. So by clicking change appointment, it will then automatically open up your phone text message pre-populate with a number and allow that patient to text in and speak with somebody within your organization to then change your appointment. So there's a number of options that these call to action buttons can add for any interaction you have with patients. So one of the newer exciting technologies that seems to have been around for a while now, but in terms of business use has only just started to come to the fore, is WhatsApp. WhatsApp has recently passed 2 billion global users and is used by 70% of the UK population. And the use case that you can see on your screens now is a fantastic way of a patient being able to communicate in the same way as they would communicate with their friends and family on WhatsApp, by sending in messages and using it in that two-way conversation style, but with the ability to send additional rich cards. So it's taking that newer technology that the RCS and the landing pages has recently showcased, and it's giving you the ability to send that information out to customers. But I really see this as a great value add for people, because WhatsApp gives the patient, in this case, the ability to reach out and engage with you. And this plugs directly into that two-way chat option. So, what I just talked about on the landing pages, again, behind the scenes, sits on our chat platform and gives your staff, your admin teams, your contact center teams the ability to have conversations in real time with people on a channel that is growing all the time, where the messages are going out instantaneously and are read and responded to in the same way as SMS messages too. They're not getting lost in inboxes like emails. They're coming through onto a channel which is starting to become people's go-to communication channels. And again, if WhatsApp isn't available on there, so, it's used by 70%, but for those other 30% and for my granddad and people like that of the world, then it can automatically default and fall back as if you're doing an outbound communication to a landing page. So you're still getting that rich content out there. You're still providing them with personalized information and call to action buttons that make it easier to do whatever they need to do. But then also, it doesn't have to be restricted to just that appointment discussions. You can have a number of different use cases, again, where you're sending out proactive communication, whether that's internal news, arranging additional cover out there. You can use it for providing a great way of your patients, particularly those who are elderly and vulnerable and who might not, unfortunately, have the same support networks around them as an ability for, communication with you. And again, most people, as you can see on the WhatsApp image there, you've got that nice camera option. A lot of people use WhatsApp for sharing images. It's a great way for getting your patients to send additional information. I've recently moved home, and one of the things that I needed to do when registering for my new GP was sending information about the property that I've moved into, my previous GP. This would have been a great tool to simplify that process and make it easier for both parties. So the final thing that I just wanted to talk through is how a lot of our customers are really getting maximum value out of all of those different channels that I've talked about today. So, whether that's SMS, voice, landing pages, they can all be used fantastically as their own individual channels. And it may be that you only have certain pieces of data available for your customer, or they've only opted into certain types of communications. But for those where you've got lots of different pieces of information and those you've got the right consents to send that out, then this slide really shows how by using Esendex and our professional services team, you can get maximum value and engage on different channels, and where you're not getting the right responses, automatically flip to another channel. So in this example, you've got all of the patient's details available. That hits our decision engine. So this is where we're seeing, right, what data can we send out to? What preferences have we got? And then we're starting to send out the communications on that preferred channel. So whether that's a text, an RCS, or a WhatsApp, it's giving you the ability to then provide either in-message examples with those rich cards and those call to action buttons, or is it providing links to the mobile journey or an online portal solution? But then if that isn't getting the right type of response, can we then flip to an outbound one? And it may be that you've got landline data. So that's where, the voice technology can really add value. Or if you're trying to send, as I've mentioned before, a WhatsApp and it's seeing that hasn't got WhatsApp installed to that number, going to an SMS and vice versa. But then alternatively, if you're not getting any responses, so, because we'll be able to see every interaction that takes place, we'll know whether those messages are delivered. If you're not getting the responses, then the patient's appointment can be removed, or we can let you know through the reporting and MI that is available. And that can just be then fed through your workflow again. You can try alternative options of reaching out to your customers, maybe collating other pieces of information about them that you can then send those future communications to. So that concludes all of the different products and solutions that I wanted to talk through today. Hopefully they've all made sense and resonated with you. But I'll now pass you back over to Warren, who will conclude the webinar today and go through the closing remarks. But thank you for everyone's time, and stay safe.
So that concludes today's webinar. We hope you found it useful and interesting. If you did have any questions about anything you've seen or heard today, please fire those into sales@esendex.com, or alternatively give us a call on 0345 356 5758. Thanks again, and we hope to speak to you soon.